It's the sound of ideas from IdeaStream Public Media. I'm Ken Schneck, in this week for Jenny Hamill. Thanks for joining us. Starting in April, Ohio cities will no longer be able to regulate tobacco sales in their communities due to a move by Ohio Republican lawmakers last week overriding Governor Mike DeWine's veto of this provision in the budget bill. It's basically a ban on local tobacco bans. I'll let you all sit with that for a second. This action on the state level trickles right down to individual cities, including Columbus, whose ban on the sale of flavored tobacco products went into effect January 1st of this year, and Cleveland, whose city council had introduced a similar ordinance last year. Republican Senate President Matt Huffman said having patchwork laws across the state would be confusing, and some Cleveland council members have expressed concern that a ban on flavored tobacco would hurt businesses. DeWine called the Statehouse move, quote, a big win for tobacco. And the city of Columbus said they are drafting a lawsuit against Ohio for infringing on home rule with the support of Cleveland and Cincinnati mayors. Last week, Mayor Justin Bibb joined other mayors across the country in calling for a federal ban on the sale of menthol cigarettes. We'll start today's show by talking to public health leaders about what impact the new law will have in Ohio, especially in a city like Cleveland, which has one of the highest smoking rates in the nation at 35% and one that disproportionately affects Black residents. The national average is 11%. Later this hour, we'll talk all about surrogacy, what the process is like in Ohio, financially, medically, and legally, and who might seek out surrogacy as a family planning option. But joining me for the first discussion is Dr. Dave Margolius, Public Health Director for the City of Cleveland. Thanks for being here.
Thank you, Ken.
And also with us is Ivanka Hall, Executive Director of the Northeast Ohio Black Health Coalition. Thanks for coming in this morning.
Thank you for having me.
But first, if you would like to join the conversation, if you have thoughts on the State House move or questions about smoking, please call 866-578-0903 or 216-578-0903. You can email us at soi@ideastream.org or tweet us. We're at Sound of Ideas. All right, sir. Dr. Margolius, you have made smoking cessation one of your main priorities since taking the role of public health director. Why is this such an important issue?
Thank you, Ken, for asking. Cleveland's life expectancy for our residents is 20 years shorter than life expectancy, even in the inner ring suburbs. People are dying here prematurely. And the number one cause of death is smoking. And, when I came into office and looked around to see who was working on this, what had been done, Ivanka Hall was the first name that came up, and she's been leading this work. For a lot of folks in Cleveland and our peers, I think folks have considered smoking to be a problem of the past. The tobacco executives have already admitted that they knew it was bad the whole time. The smoking rate across the country has been declining and declining. But it was time really to bring a mainstream effort through the city of Cleveland to work together to build this coalition to expose the structural racism of the predatory marketing of menthol cigarettes in particular.
Yeah. Ivanka, I want to play a clip here from last week's Senate veto override hearing. This is Senator Herschel Craig, a Black lawmaker in Columbus.
My mother died of stage 4 cancer smoking. My father-in-law died of stage 4 cancer. I was talking to, just yesterday, with a police officer that served the city of Columbus for 30 years, who had never smoked, but because of secondhand smoke, now has stage 4 cancer.
Can you talk a little bit, Ivanka, about the role tobacco companies have played in targeting Black communities?
So one of the things that we know is that tobacco has all types of additives and things in it. But when we're talking about the one thing that we want removed, which is menthol and flavors, that makes it more addictive for our communities. And so what they have done is purposely targeted communities through these kind of feel-good concerts and, sponsoring sporting events and jazz shows and gospel things, and then selling us poison. or in their case, giving out poison for many years in our communities. And so we have been deliberately targeted by the tobacco corporations on purpose. And so what menthol does is menthol allows it gives you a cooling sensation when you smoke the cigarette or the cigar, or you are using flavored products, and it causes the poison to go deeper into your lungs. And so when we talk about these deaths from smoking, it's these smoking related morbidities, cancer and heart disease, COPD, all of those things and asthma, all of the things that are disproportionately impacting African American communities.
Let's talk about the state level, and then we'll drill it down to Cleveland. Dr. Margolis, what do you think about the State House's move to ban cities putting their own regulations in place?
Well, it's extremely frustrating. And what they've done with this ban on local bans is not only affect the few cities in Ohio that have started to implement a ban on flavored products, but they've also done away with all local tobacco regulation. So in Cuyahoga County, I think there are 8 or 9 suburbs that have had a tobacco retail license system. Cleveland Heights, Lakewood, Euclid, Brook Park, Maple Heights, a few examples. And so tobacco retailers had to buy from the county Board of Health a license, and it meant that they were subject to health inspections from maybe like a 19-year-old over the summer trying to buy tobacco. And so all of that goes away because the state legislature sided with Big Tobacco to do away with all local tobacco regulation.
And then, Ivanka, here in Cleveland, as I mentioned earlier, we had the ban introduced by Cleveland City Council, but it sounded like some leaders were concerned about how such a ban would hurt businesses, including Black-owned businesses and businesses in Black neighborhoods. You're already shaking your head.
Well, one of the things that we did is we did our research. We didn't just start this without knowing the backstory. And so what we did was looked at other regulations that had taken place across the country and saw how it impacted business. So businesses may lose a little business, but they always find another thing to sell. And so businesses are in the business of making money. And so they find another way to make money. But businesses haven't had to close. So businesses haven't been impacted where they've had to close. The large majority of these businesses are not Black-owned. They are not owned within those communities. The people who own these small businesses that are in urban areas are not urban residents or urban dwellers. And so when we look at, what has happened across the state, we have to understand that Ohio is shooting itself in the foot. They actually issued a study last week. So it was this Forbes advisory study that measured these 21 health metrics across the 50 states, and they ranked Ohio as 41 out of 50. And the reason we were ranked 41 out of 50 is because 20% of Ohioans smoke. And so when you look at what happens to businesses as a direct result of this, is businesses won't do business with the state of Ohio because the risk factors of them having employees that smoke, the health impact of their paying out more in insurance, they're not going to risk it. And so you look at the fact, when you look at the ranking of these states, West Virginia and Pennsylvania rank better than Ohio. And so the possibility of them having more businesses, being attracted to businesses, and us being less attractive because of what's going on in our legislature is something that we must make sure that we understand.
Yeah. We have an email in from Sue. Sue says, as a daughter of a man who died of smoking-related heart disease, I don't use the product, and for those who do, they may have the same results. Columbus should be promoting health, not aiding the death of Ohioans. How do you navigate these conversations, Dr. Margolius? You are not, I hope this is not a revelation for you, you are not the director of small business here in Cleveland.
Right.
You work in public health. So how do you find that middle ground of talking about small businesses, the economic effects, but also obviously the public health effects?
Yeah, so when we first started talking about this legislation with council folks and with other stakeholders in the community, we heard the feedback. What about these small businesses? What about the mom and pops? So our team cataloged all 600 tobacco retailers in the city of Cleveland, 600, one for every 600 residents. That's not by accident. And we learned, exactly as Ivanka said, that most of these retailers are chains. They don't live in Cleveland. They are not small-owned Black businesses. They're hurting communities, many of them. And so I remember bringing this spreadsheet of, all the businesses to kind of show to one of our meetings that we had with Black faith leaders in Cleveland. And I passed the spreadsheet across the table to Dr. C.J. Matthews, who's this incredible faith leader on the east side of Cleveland. And I said, here are the businesses. I've heard the concern about the businesses. And he took the spreadsheet, turned it upside down, and pushed it right back to me and said, it doesn't matter. It's wrong. We have to protect people's health. That's what we're here for. That's the cause. We've got to extend life expectancy and improve quality of life in the city of Cleveland. And so who cares if there are businesses that are going to lose money if they're selling poison to children?
Yeah. Which brings us to vaping. Let's touch quickly on vaping. For folks who don't know what vaping is it still a thing? Is it still prevalent? Where are we at with vaping?
Yeah, vaping is a thing. It's probably 4% of Clevelanders vape. And the big problem with vaping is you'll hear tobacco or vaping executives say, oh, no, we're harm reduction. We're trying to help people quit smoking. But then why would they develop vape flavors that are called cotton candy, bubble gum? Why would they put those vape stores right next to schools? Why would the vape aisle be right next to the candy aisle at the cash register? And so it's clear the vaping industry is trying to find new customers to be addicted to nicotine to, help them as the smoking rate across the country continues to decline.
We'd love to get both of your thoughts on, let's talk about cessation. Ivanka, with what's going on in Columbus and the law that's going to be, or the veto override that's about to happen, how does that affect cessation and your work?
Well, we would hope that they would say, okay, if we did a veto override of this, that we put more money into cessation programs, because that would be the logical thing to do. Is that, okay, if we're not going to do this legislation, that we allow people an opportunity to be able to quit, and that we fund quit programs. But what we've seen traditionally is that didn't work. That we had the money to fund those quit programs, and when other states were actually doing the work, we were not. And that's why we are in the predicament that we're in now, that other states' smoking rates have gone down and ours have steadily increased. And so we have to make sure that we do everything that we can to make sure that we have cessation programs that are available, whether they're within our communities, in our hospitals, in our clinics, that we have those cessation programs available for our community members to be able to access. Because I think that's the other thing, is that they have to be something that's available and accessible for the community members.
We have someone listening in, Dr. Margolius, who maybe they want to stop smoking or stop someone in their life smoking. You have about 48 seconds to be effective in reducing the smoking rates.
Great. So it's really important that folks know that we are not out to get people who smoke. We're here to help. Most people who smoke want to quit. It's just so hard. There are resources out there. One easy to remember number is just calling 211, and you can get connected to a cessation a quit line. And it's, for those with loved ones who smoke, please do not give up on them. They want to quit. It's just so hard. Menthol in particular, flavored products in particular. And in Cleveland, where we've let 600 tobacco retailers, 4 out of 5 schools have a tobacco retailer within 2 blocks. So we're here to support you, and policy would be the best way to get there.
Okay, so we all have a role in that. Last words, Ivanka, on what everyone can do?
For me, I think it's important for us to understand the long-term impact of smoking and what it does, not only to us, to our families. I have bronchitis because my grandfather smoked, and so I understand the realities of what happens with secondhand smoke. And so we have to understand that we have to protect our citizens at all costs.
Okay. I want to thank both of you here to talk about this really important topic. Dr. Dave Margolius, Public Health Director for the City of Cleveland, and Ivanka Hall, Executive Director of the Northeast Ohio Black Health Coalition. Thank you both for coming in to talk about this today.
Thank you for having me.
Thank you, Ken.
Time now for a quick break. When we return, we're going to talk about the role that surrogacy can play in family planning. This is The Sound of Ideas. I'm Ken Schneck, in for Jenny Hamill. We'll be right back.
At 9:21, you're tuned into The Sound of Ideas right here on WKSU, IdeaStream Public Media. Support for our programming today comes from
SummaCare, with Medicare Advantage plans from Canton to Cleveland and Youngstown to Toledo. SummaCare is an HMO and HMO POS plan with a Medicare contract. Enrollment in SummaCare depends on contract renewal. More at sumacare.com/Medicare Radio.
It always feels good to give back to our community. It's even better feeling when it happens effortlessly. When you become a sustaining member of IdeaStream Public Media, all you need to do is choose a monthly donation level that fits your budget. Starting at $5 per month, you get to choose from our new Idea Streaming bundles. From there, let us do the rest. Visit ideastream.org/bundle to become a sustaining member. With the support of sustaining members who care, we take you there.
If we contribute DNA samples for a study, should the scientists share their results with us?
Being self-determined, having autonomy over your own data, how it's consumed, how it's presented. I mean, everybody should have that right.
Changing the relationship between researchers and the people who participate in their studies on All Things Considered from NPR News.
And you can join us later today at 4 with All Things Considered with your local host Amanda Rabinowitz here on WKSU IdeaStream Public Media.
You're listening to The Sound of Ideas, IdeaStream Public Media. I'm Ken Schneck, in this week for Jenny Hamill. Thanks for being with us this hour. Earlier this month, the head of the Catholic Church, Pope Francis, called for a global ban on surrogacy, saying, quote, "A child is always a gift and never the basis of a commercial contract," end quote. He also claimed that surrogacy exploits the women who carry the children. This announcement caused pretty expected outrage for many surrogacy advocates, including reproductive doctors, fertility advocates, and gestational surrogates. They say that the Pope's comments are misguided. We wanted to spend the rest of the hour learning more about the different types of surrogacy, how it works here in Ohio, and the many steps involved in the practice that helps many individuals and couples become parents. Joining me to discuss surrogacy is Dr. Priya Masalal, a reproductive endocrinologist and infertility specialist and the medical director of reproductive gynecology and infertility in Akron. Thanks so much for calling in. Dr. Priya? Okay, we'll get her in on the line. We also have on the phone Rebecca Horvath, a gestational carrier and a stay-at-home mom. Thanks for joining us, Rebecca.
Hi, thanks for having me.
And calling in from Denver is Judith Huxt, a NICU registered nurse clinician, assisted reproductive technology attorney, and board member of Resolve, the National Fertility Association. And her son was born by a gestational carrier. And in full disclosure, I should share here that Judith is also my attorney on my own personal journey with surrogacy. Though I do promise to all of you that my retainer to Judith does not predetermine any of her answers except who her favorite client this hour might be. Judith, thanks so much for waking up early to be with us.
Thank you for having me today.
If you would like to join in on this conversation about surrogacy, please call 866-578-0903 or 216-578-0903, or you can email us at soi@ideastream.org or tweet us. We're at Sound of Ideas. Dr. Masalal, we're going to start with you. Can you please explain the different types of surrogacy? Let's start with some sort of baseline and why surrogacy might be brought up as an option for individuals.
And sure, Ken, that question was directed to me. It's
yes.
Mostly when women or individuals are unable to carry a pregnancy to term themselves. So they look at surrogacy or finding a gestational carrier to help them with that process.
And there's different types of surrogacy, right? Traditional, gestational. Can you explain what those phrases mean?
Sure. So the nomenclature is really tricky, and oftentimes we're using these terms interchangeably when they mean different things.
Okay, we might have lost the doctor there, so we're going to pivot over to Judith as we get Doctor back online. Judith, in addition to being a surrogacy attorney, you also have firsthand experience with the process with your own family, correct?
Yes, that's true.
Tell us about that.
Well, my husband and I struggled for over a decade with infertility, trying to for me to be able to get pregnant and to sustain a pregnancy. And I experienced a number of miscarriages when able to finally sustain a pregnancy. And I was living in Cleveland at the time and going to law school there and working as a nurse over at Case Western in their Rainbow Babies and Children's Hospital in their level 4 NICU and a pediatric ICU, going to school and working and trying to get pregnant. And I experienced yet another miscarriage in my second year of law school. And my OB said, I am going to take a peek inside your uterus and see what's happening in there, if there's any anatomical reason why you are miscarrying. And so I had what's called a hysteroscopy, and she found some polyps on one side of my uterus and some scar tissue on the other side. And she said, I'm going to do a D&C. I'm going to be aggressive, but not so aggressive that I would ruin your uterine lining. And she did the procedure. And afterwards, my menstrual cycles changed, not the frequency, but how much of my uterine lining I would shed every month lessened. I thought it was due to stress and lack of sleep with being in law school, but I found out over a decade later when I finally was seen by a very exceptional infertility clinic here in Denver, that I had something called Asherman syndrome, which is scarring of the endometrium. And it can be caused, one of the number one causes I learned was a D&C. And so it was the reason why I kept miscarrying.
And then what does it mean to then do this work on the legal side? I would imagine that your personal experience informed so much of the legal work that you're doing.
You know, it's made me so passionate about my work, Ken, because I've walked this walk of infertility. The World Health Organization this year released new statistics on the incidence of infertility as a diagnosis. 1 in 6 people worldwide struggle with infertility. That number's huge. And so because of what happened with me and my husband trying to have a family, we were able to have our first child. I almost lost my life in the delivery room from hemorrhaging due to the problems I had with my uterus. And so surrogacy was recommended to me. We had 2 options to have a child. We had adoption or we had surrogacy. And at that time, I had experienced so much loss that I chose surrogacy because in the end, I knew that I would have my baby to take home.
Thank you for that. Rebecca, you chose to become a gestational carrier and you carried a child last year. You also have, I'm told, 5 children with your wife. And this is the breakdown that we hear, Rebecca. 1 that you carried, 1 that your wife carried, and you've adopted 3 children through foster care. You have experienced a lot of paths to parenthood, Rebecca.
Yes, that's true. 5 kids, and you got the breakdown correct. We've been... we had a lot of help making our family.
Can you talk a little bit about your decision to become a gestational carrier and what that process was like for you?
Sure. So I think because it took, we went through, my wife and I, an unconventional path to parenthood, and we had so much help creating our family. After reading an article about an acquaintance of mine that had been a surrogate, I started to think, gosh, this is something I could do that could help somebody else create the family that they want to have.
And Dr. Masalal, who is back, can I confirm that? Dr. Masalal, are you there?
Yes, I'm here. I apologize.
Oh my gosh, it's great to have you back. You were actually Rebecca's doctor while she was going through this journey. Can you talk a little bit about what was involved medically for the intended parents and what's involved for the gestational carrier?
Right. So medically for the intended parents, first they have to create an embryo. And so that's essentially going through in vitro fertilization and freezing that embryo. And then, in most cases, freezing that embryo. And then finding a appropriate gestational carrier. And so a gestational carrier has to be vetted. They go through a medical history, a physical exam, different laboratory values, including infectious disease testing, preconceptional testing. They go through a psychosocial exam and counseling, both for the patient and in Rebecca's case, her partner or wife as well. And then a uterine cavity evaluation, just to make sure that that uterus is appropriate and great for carrying a baby. And the last part about it that Judith can extrapolate on is the legal counseling, and the legal contract is the last part of the requirements that both parties need to go through.
That cues up Judith quite nicely. Judith, there are all these different types of surrogacy agreements, but can we talk about that counseling part first? Tell us about the mental health piece of this whole puzzle.
Well, the American Society of Reproductive Medicine has key points and recommendations in place for gestational carriers and for intended parents. And so they recommend independent legal counsel regarding the contract and the entire arrangement. And so I was involved in drafting the surrogacy statute for Colorado, and my colleague and I drafted it together. We looked at ASRM, American Society of Reproductive Medicine's guidelines, and we followed them. And so it's really significant and important that each side to a surrogacy arrangement have independent legal counsel, not the same attorney representing both of them together, but separate attorneys, because it's important to codify or to get down into the contract the protections that are in place for the surrogate and for the intended parents, because that leads to protections for the child.
And can you talk a little bit about the different types of agreements? There are altruistic agreements, compassionate agreements. What do those words mean in this context?
So there's compassionate surrogacy, also called altruistic surrogacy, and I have quite a number of those surrogacy matters where for right now I've got a sister carrying for her brother and his wife who will be giving birth this week. I have a niece carrying for an aunt. I've never had a mother carrying for a daughter, but certainly you read about that. But I have two teachers that are friends that one is carrying for her best friend. And so those are usually not usually, but often altruistic, where no compensation, or I don't like to call it compensation, but pre-birth support is paid to the surrogate, but reimbursement of expenses are paid. And so those terms are actually drafted into a contract. The majority of surrogacies actually, do have pre-birth support paid to the surrogate, similar to what's often paid in adoption, where a birth mother who's relinquishing to identified parents who will adopt often pay pre-birth support so that she's not worrying about how she's going to pay her rent or her food, her utilities. It's happening in surrogacy as well.
If you'd like to join this conversation on surrogacy, please call 866-578-0903 or 216-578-0903. You can email us at soi@ideastream.org or tweet us. We're at Sound of Ideas. We want to hear from you. Rebecca, can you talk a little bit more about that counseling aspect of navigating these different steps? We talked about some of the physical aspects. Can you elaborate more on your journey and how counseling played into that?
Right. So prior to transfer of the embryo, and usually prior to legal as well, that's usually the last step, I believe, in order to become a gestational carrier, it's required that you have a psychiatric evaluation done to make sure that you are of sound mind and capable of basically being a gestational carrier. So in our case, and I think this is pretty much with every gestational carrier, there is an evaluation of the carrier herself and then their partner, if they have one, and then also the intended parents. And then we did this via Zoom because the person who was doing the evaluation wasn't local. And then after they did us and the intended parents, then we had kind of a Zoom call together.
Thank you. And reminding folks, we are talking with Dr. Priya Masalal with Reproductive Gynecology and Infertility in Akron, Rebecca Horvath, a gestational carrier and a stay-at-home mom, and Judith Hoxt with Resolve, the National Fertility Association. Can we actually circle back to where we started, Dr. Masalal, just in case we missed anything when the phone cut out? Can we start over with the different types of surrogacy and why people might need surrogates?
Certainly. I guess we'll go first with why people may need surrogates. It's basically when a woman or an individual is unable to carry a pregnancy to term, and people may think what that means. And usually it's in women that have had recurrent losses or implantation failures, medical conditions which preclude them from carrying, like severe high blood pressure or problems with their lungs like pulmonary hypertension, and these conditions would put the mother at significant risk for carrying. Women without a uterus, so believe it or not, people can generally have absence of the uterus, or it was lost in surgery. I think Judith commented how she had postpartum hemorrhage, and it was, life-altering, and then she wasn't able to carry, so that's a very common cause. Women that have uterine fibroids or scar tissue or adhesions that are inoperable or they just can't carry. And certainly, just like Ken, you had mentioned that you were looking for a gestational carrier or going through the process. So males or same-sex couples that want to have children. And I think those are really a lot of people that require it. I think they estimate around 8,000 cycles in 2021 in America that were using gestational carriers, and that figure is only climbing. To answer your first question, what's the difference between surrogacy? And I think I mentioned before, it is we use the term surrogacy and gestational carriers intermixed, but traditional surrogates are people that are using their own eggs and then sperm from an intended parent or a donor, but that is not really as common anymore for a variety of reasons. And gestational carriers are people like Rebecca, where they do not share the DNA with the intended parents.
Judith, it's not every day that the Pope weighs in on the work that we do in our professional lives. I know that you certainly spoke to some national media when the Pope made his comments. Can you talk a little bit about your reaction to hearing the Pope talk about surrogacy?
Oh, sure can. Well, so I was raised Catholic and am the product of all Catholic education from kindergarten through 12th grade. I am not a practicing Catholic, and I fell away from the church in my early 20s because of the church's stance on birth control. So it's not uncommon for this to happen. My siblings have done the same, many of the friends I grew up with, and it's because we feel like the church is out of touch with our society. And so when the Pope made his broad statement for a worldwide ban, it angered me, but it also confirmed, why I've fallen away from the church. And I feel that he does not understand the pain that goes with infertility. The Catholic Church believes that a child should be formed only from sexual relations, and the majority of Catholics believe in using science and IVF. They believe in using birth control. And honestly, Ken, I still feel like a Catholic in my core, even though I'm not a practicing Catholic, but I believe that science would not be advanced but for God, and my child would not exist on this earth but for God.
We're going to take a quick break here. Again, you're listening to The Sound of Ideas. I'm Ken Schneck in for Jenny Hamill. We know that we have calls on the line, and we're going to get right to those calls right after a break. If you want to weigh in, 866-578-0903.
At 9:40, you're tuned into The Sound of Ideas here on WKSU, IdeaStream Public Media. Support for our programming comes from
the business law firm Thompson Hine, where a commitment to always innovating helps to solve complex client problems efficiently and with transparency. More information about the Thompson Hine approach to innovation is at thompsonhine.com.
Quick reminder, if you like what you're hearing and want to elevate your impact, consider becoming one of IdeaStream Public Media's sustaining members. You can start by choosing from one of 3 Idea Streaming bundles ranging from just $5 to $15 per month. And you can get access to IdeaStream Passport, a Roku streaming device, and a smart speaker. Visit ideastream.org/bundle to become a sustaining member. With the support of sustaining members who care, we take you there.
Welcome back to The Sound of Ideas. I'm Ken Schneck. In this week for Jenny Hamill, we are talking all about surrogacy. And we are going to go to our phone line. We have Scott calling in from Oberlin. Scott, thanks so much for calling in.
Howdy, folks. Excellent topic. And my background, I'm adopted. I was adopted 60-plus years ago, and it was through the Catholic system. So my birth mother came to St. Anne's in Cleveland from down in Florida, had her baby, and then as soon as I was delivered, boom, she disappeared. I went into with my adopted family, but my daughter, my biological daughter, she's out in California. She's got a very, very good friend in here that she went into surrogacy herself. But she was doing it for a couple, so she was implanted with the embryo, and then got a stipend, got all the medical stuff. It's apparently very well regulated out in California and everything, and had the baby, and then got a sizable monetary compensation that she and her husband were able to use to put aside for a good college fund for their kids who are teenagers, and so that they can look forward to college and everything, because they're working class folks, and and things had been kind of hard for them coming up and everything. So and it's like I would like to see as many people that want to have kids and raise kids and stuff be able to do it. And I think, this is a good thing to help people all around. But once again, it was really well controlled and monitored by the state. So, it's like, I want to say there was no exploitation whatsoever. It was a choice that everyone made.
Thank you so much for that. That's Scott calling in from Oberlin. We're joined here with Dr. Priya Masalal, Rebecca Horvath, and Judith Hoxt. Judith, I would imagine, as Scott pointed out, there are many different types of arrangements, many different types of contracts that families create together. Is that correct?
That's correct. And I want to follow up on what the gentleman just said about that the surrogate in California received a large stipend at the end. Here's how it usually works. So, for example, in Colorado, the compensation paid to a first-time surrogate, and again, compensation is that pre-birth support, tends to be about $40,000 over the course of the entire pregnancy. And so payments are made every month for her pre-birth support. So if you take $40,000 and you divide it by 10 months, her pre-birth support would be about $4,000 a month. And the surrogate can do what she wishes to do with that compensation. Our surrogate, who cared for my husband and I, was a first-time surrogate for us. She lived in California at that time. We had a contract in place to protect all parties. And she went on to be a surrogate 2 more times, and she used her compensation or her pre-birth support and went to nursing school, became a nurse, worked in a fertility clinic, and is now an emergency room nurse. And we keep in touch with her today.
If you'd like to join this conversation about surrogacy, please call 866-578-0903 or 216-578-0903. We want to see those emails coming in, soi@ideastream.org, or some tweets. Tweet us. We're at Sound of Ideas. Rebecca, what do you have to say to other gestational carriers who are considering this process, or just families who are considering the surrogacy journey?
Thanks for the question. I would say that if you go through all of the proper channels that are required to become a gestational carrier, it can be one of the most incredible experiences. I think I was very lucky because I have heard, stories of other gestational carriers not having such a great experience. And everyone's different. Some people, I did what was called an independent journey where I did not use an agency. We still obviously had to go through legal and have contracts and independent attorneys on either side and everything, but we did not have an agency. So that kind of cut out the middleman. And I was able to talk with the intended parents as frequently as I wanted to, and they were able to attend any appointments that they wanted to. Some people who go through agencies, as Judith was saying, you can have a gestational carrier in a completely different state. Some people have them in different countries. You kind of have to figure out what you want out of that relationship and make sure you match with intended parents that have the same wants that you do.
Dr. Mosel, I have to imagine you hear a ton of common misconceptions about surrogacy. Can you tell us about some of those?
Sure. I think people think that it's an easy way out. I don't think people realize how many people need them given their medical conditions. And I think that a lot of people think it's exploitation. I think the Pope, when he talked about it, his fear was there'd be exploitation of people that needed money. And as we've already spoken about, it's about pre-birth support and a gift. And I think there's altruism in every single person that is a gestational carrier. And so I think people just don't know. Just like anything else in life, I think the fertility journey in general, I think people are can be misconceived or ignorant really about the process of what people go through that are trying to become families. And just as Scott said, there's many ways to build your families, from adoption to using fertility services. And so we talk about all those with parents that come to us that want to grow their families. And I think that people think that it's unregulated. There's no federal regulation of surrogacy and gestational carriers, but there are state regulations. I think Judith can confirm this, but 3 states right now, surrogacy is illegal. And, Rebecca spoke about different requirements. There's really a much vetting. Only 2% of people that want to become gestational carriers actually become gestational carriers. So this process is very, very vetted. In fact, RGI, our parent company, is called Pinnacle Fertility, and we actually have a surrogacy agency. And the requirements are to keep the gestational carriers safe and also to have the best experience in the matching between the intended parents and the gestational carrier is very, very individual. What Rebecca may have matched with one person, but it may not have been another a good match for a different intended parent. So there's so many, Ken, misconceptions, but I think that we're bringing light to this way of growing families, and it's becoming more and more accessible for people.
Let's talk about those regulations, Judith. And you can't get too legal on me, Judith, because you're going to lose me. So in our most basic terms, you've lived in Ohio, you're living in Colorado. We're not that far apart, a couple different time zones, but completely different landscape with regards to regulation for surrogacy.
So many states have surrogacy statutes in place to protect all parties to a surrogacy arrangement. And the doctor was right. There are 3 states where compensated surrogacy is illegal. One is Michigan, one's Louisiana, and the other's Nebraska. Michigan is getting ready to pass a surrogacy statute that they've looked at Colorado's because our statute is very comprehensive and very protective. So, how does it protect? In Colorado, for intended parents, you have to be 21 years of age or older. You have to have a medical evaluation related to the surrogacy, and that evaluation is determined by the fertility clinic. You must be represented by a licensed Colorado attorney here in Colorado. whether you're out of state or in state, if your surrogacy is taking place in the state or the medical care is in the state and you want to follow Colorado law, you must be represented by a Colorado attorney. And then last, the contract must be signed and notarized before the surrogate can even commence her medications for an embryo transfer procedure. The surrogate has to be 21 years of age or older, must have given birth to at least one child. She must have a medical evaluation related to the surrogacy and a mental health consultation by a licensed professional prior to being permitted to enter into a surrogacy contract. So the fertility clinic actually must give clearance for her to enter into the agreement, and that's to protect her and to protect her health. The other side is to protect the intended parents, but the ultimate goal is to protect a child as well who's being born through surrogacy.
Rebecca, there's the legal part, there's a medical part, but obviously this is quite personal. Can you talk more about what it was like going through this process personally, what it was like during your pregnancy and after the birth when the intended parents met their child?
Sure. So yes, it is a very personal process, which is why, as I had said before, I think you have to make sure that it's a really good match between the gestational carrier and the intended parents. So my intended parents were local, which made it so that, as I said before, they were able to attend any doctor's appointments that they wanted to. And I could call them or send them messages, letting them know, when their baby was kicking, just personal things like that you can share with somebody if you have that relationship. And I know there are gestational carriers and intended parents matched that do not get to share that info, whether it's a language barrier, being that the parents are from a different country or what's going on with that. I think a lot of my friends and people close to me would ask, if I was nervous about actually giving birth and what would happen when I didn't get to bring the baby home with me. And having 5 kids of my own, I was completely 100% sure that I didn't want to go home with another baby. And that's part of what the psych evaluation does, is to make sure that you're stable in your thinking and that you're not going to go home with this baby. As far as actually giving birth, that was the most incredible part of the journey. I had a very easy, healthy pregnancy, but with all that said, I'm not one of those people who loves being pregnant. I don't think, I don't know. I truly can't understand the people that love being pregnant because it's very uncomfortable, in my opinion. But the delivery day was the best part of the whole experience. My intended parents were able to be in the room. Baby got to go right to mom. It was just, everything that gestational carrier, everything that surrogacy should be.
Let me ask you, Judith, and thank you so much for sharing that, Rebecca. We do want to talk about similar experiences. Judith, did any of that resonate with you, with your experience?
Gosh, she almost made me cry just now, because to be in the delivery room. So first of all, I experienced this as a parent because our surrogate gave birth. She gave birth by C-section. My husband and I were both in the room. And when our son was born, I knew his cry in my soul, as if I had carried him. It was the most beautiful moment of my life outside of my daughter's delivery. It was priceless and breathtaking, and there was so much crying in the delivery room by all those around us who experienced this birth. And I can tell you, because I was a NICU nurse, while I was practicing law, I continued nursing on weekends. I would go to some surrogate deliveries, and what happened in the delivery rooms every time was magic. It's hard to describe. It's just so beautiful.
I heard his cry in my soul. Judith, they're not going to have me back if I get choked up on the air. If you could limit things like that, that was incredible. Judith, can you also just talk a little bit about some resources for intended parents that might want to learn more about surrogacy?
Sure. So Resolve, the National Infertility Association, Ken, when you introduced me, you said I was a board member of Resolve. They do just phenomenal work and they support those who are going through infertility. And so if you look at the Resolve website, you'll find many resources regarding infertility care, including surrogacy. The American Society of Reproductive Medicine, has ethics committee opinions and support for those who are trying to learn about surrogacy. You can get online and Google it and find, a good amount of information.
And let's pivot over to you, Dr. Masalal. Can you also talk about resources that might be available?
Sure. I mean, I think your number one resource is your infertility doctor themselves. At RGI, we have different doctors. Each takes responsibility for an individual patient. And no matter what that patient needs, the doctor can talk about the agencies that we are affiliated with. The agencies actually help you with, vetting the different gestational carriers that are available, matching you, case management, and ongoing care. And right now, the demand for gestational carriers is higher than the availability. So we're talking about where we can get them. People actually look through word of mouth, like Rebecca said. There's actually Facebook groups that can match people with surrogacy, or at least introduce each other to surrogacy. And then, as the doctor, we really try to look at what the intended parent's looking for. Are they looking for a local person? Or, what are their requirements for the gestational carrier? I mean, they may want to share similar ethics and things like that. So I think it's really, really important. And the other part that we haven't spoken about is the creation of embryos. I mean, the intended parents have to create an embryo to put it in. So while you are looking for your gestational carrier, you're simultaneously going through an in vitro fertilization cycle typically. And so we are helping them have something to put in the gestational carriers.
A really important conversation. I want to thank our guests for joining us today. Dr. Priya Masalal with Reproductive Gynecology and Infertility in Akron. Doctor, thank you so much for calling in.
Well, thank you for having me.
Rebecca Horvath, a gestational carrier, stay-at-home mom. You got your hands full there. 5 kids there, Rebecca. Thank you so much for taking the time to call in.
Yes, thanks for having me.
And Judith Hoxt with Resolve, the National Fertility Association. If you had to pick a favorite client this hour, who would it be, Judith?
Ken, it would be you.
I appreciate that, and thank you for all of your work. Thanks for being with us today. To get the last word on today's topic, send an email to soi@ideastream.org. We're on Twitter, now X, at Sound of Ideas, and you can follow me. I'm at Dr. Ken Schneck, Dr. Ken Schneck. We received a lot of feedback about yesterday's Makers Monday show, where we discussed entrepreneurship in the region, and we asked you to tell us your business ideas. Jeff sent in this email. I'm a local Clevelander who has worked in innovation for more than 30 years. My company, Ideas in Focus, is a voice of the customer advisory firm that offers idea generation, opportunity assessment, research, and strategy. Over the years, I've helped everyone from one-person innovators working from the garage who have an idea to some of the world's largest consumer goods. Thank you for that email, Jeff. Thanks for sharing your ideas with us. And again, you can send it to us at soi@ideastream.org. Tomorrow on The Sound of Ideas, we'll talk about a new Center for Community Solutions report that looks more closely at the state of women in Ohio. Plus, we're going to hear about the coolest gadgets that came out of this year's Consumer Electronics Show in Las Vegas. If you missed any portion of this program, find us online or listen to the Sound of Ideas podcast. You can also hear a rebroadcast at 9 on 89.7 WKSU. I'm Ken Schneck, in this week for Jenny Hemmel. Thanks for listening. I'll talk with you again tomorrow.
Support for WKSU is provided by the Cleveland Orchestra. Beethoven's Pastoral Symphony is programmed alongside the Egmont Overture and Haydn's First Cello Concerto, February 22nd through the 25th at Severance. Tickets at clevelandorchestra.com.
You're listening to 89.7 WKSU Kent, a public media service licensed to Kent State University and operated by IdeaStream Public Media.